Hi, everyone. I'm so excited for our next guest on this Wellness Warrior podcast. I've got Dr. Ellie, who's also the founder of Ellie's Zellies. So we'll get into that story, but I'm really excited to hear about her journey in the world of dentistry that she's been in for 50 years. Obviously, what you're doing is, your beauty is a reflection of your lifestyle and what you're doing. So thank you so much for joining us and taking the time to share your story.
Well, it's been an interesting journey. I can tell you that. I've done so many different things, and it wasn't always my choice. I look back and I happen to believe the end product has been great, but along the way it's been, challenging decisions because when you make decisions for what you believe in your heart, it's not always easy. And it's taken me along a very different path from most dentists, which I think is why I see dentistry a little differently from many of the people that you interact with or have interacted with. I talked to a number of people who work with biologic dentists and holistic practitioners, and I think my view of the mouth is different even from everything you may have heard before.
Okay, well, I'm excited to hear that.
Direction. So
Now, so you've been in the dental industry for 50 years. So tell us a little bit about you. You were mentioning before we started recording that dentistry was very different in the 60s. And you studied in the UK and in Switzerland as well. So give us a little bit of background about that.
well, I was fortunate because I had a father who believed women could do whatever they wanted to do. He wasn't in the groove of the moment was that women should be secretaries or nurses. They hadn't got the mental capacity to be a dentist or a doctor or an attorney or anything. And so it was a very unusual career for a woman to be in dentistry at that time. There were 7 women, I think it was, and 700 men at my dental school. Mm-hmm.
Wow.
So, and they had different requirements for us getting into dental school. And I hated that at the time. I mean, I rebelled internally. I had to do it because there was no other way to get into dental school. You had to have physics, chemistry, and biology at a top level, your sort of 4.0 level, college level, to get into dental school as a woman. And so my parents actually sent me to a special college, Cheltenham Ladies College in England, which was the only one of, I think, 3 schools that could get women into these professional careers. And it was from the age of, I think I was 10 when I actually arrived at school, 10 and a half, till I went to college, studying from very early age, physics, chemistry, and biology, 6 days a week.
Wow.
I mean, these little kids, I didn't do normal things that normal kids did. I studied and we went to school on Saturdays, and I had fantastic teachers of physics and biology and chemistry. I used to go to bed with a tape, one of those brown tape recording machines, plugged into my head to get all the scientific, chemistry equations and things, totally brainwashed in the subject of science. And then I was fortunate to be at London at a time, as I was saying to you, in dentistry in the 60s, the conversation at dental school was, how do we stop cavities? I mean, that's what people were trying to do, stop people suffering from cavities. Gum disease wasn't even considered. Nobody looked at the gum tissue as even in the mouth at that point. And so I was rubbing shoulders with people who today are absolute icons. John Featherstone is one, and there are many more. And I actually have a terrific book that was very helpful to me all the way through. It's 25 authors from Europe, all scientists, and their scientific evaluations of certain areas of the mouth. And I mean, it's been a journey that I wouldn't have been on if I had just come to. Anyone who's been to dental school or hygiene school in the 70s is probably somewhat on that pathway. But after that, dentistry really did a big switch in the early 80s. And anyone who remembers the makeover, do you remember those TV programs where patients would go in and have the complete mouth makeover? And that was really exciting for people because You know, if you had broken down old teeth that were damaged and brown and big cavities, you could go in and these crowns could make you look wonderful, like immediately.
Right.
One day change. And I think your smile does more for you than pretty much anything else, maybe hair and so on, but it's a huge beauty asset. And so people were so excited about these crowns and bridges, and that has been the kind of dentistry people have demanded, I would say, for the last 20 years, maybe longer, 30 years almost now. And sadly, because of that, I think the focus switched. And people were more excited about doing a photo shoot at the end of their dental appointment than knowing if their mouth was healthy. And the crowns mask everything. I mean, you don't know how healthy or unhealthy your mouth is if you just go by how your teeth look. You know, one of my favorite questions to ask people is, how healthy is your mouth?
And how do you know? How do you know that?
How do you know? It's a good question. I ask that question to everybody because I have a different philosophy of how to look after your teeth for many people. And I'm going to start right here and shock you. I have never flossed a day in my life. I do own floss, because if you get something really stuck, it is a useful tool. But I have never used it. I've never recommended it to any patient listening on, on any broadcast. Will never have been told to floss by me, ever.
And why is that?
Because the whole mouth is an ecology. Your entire mouth has to be seen differently. And floss is inadequate, first of all, to change your mouth health. It's a length of string. If you had an infection on your finger, would you try cleaning it with a length of string? There would be much better ways to do it. I would say that dipping it in a liquid or even brushing it would be more effective than a length of string. I never understood why floss was so important.
Interesting.
Second point is I was starting my career, as I mentioned to you, in Switzerland. And in Switzerland, floss was not used. So I saw people with healthy mouths who were not flossing. So I didn't get brainwashed at dental school because we didn't talk about floss. I didn't see it in my first practice where I saw so many healthy mouths and wanted to copy their philosophies. And then I, in my own office, which was the next 10 years, used other systems for helping patients rather than flossing. And it worked. And I saw cavities reverse and finally gum disease reverse. And without the use of floss. So when I came to America, and that was after that experience, I have experienced a lot of pushback to this floss, non-floss. I was actually sort of pulled off a podium giving a speech one time by a dentist who didn't like my general direction I was taking the conversation. And the consequence of that was that I put out a challenge to dentists. Let's test our mouth health.
Right.
If we're going to be so dogmatic that one way is better than another, and you can go to a dentist in any part of the country and probably be told something else or given a different product. Some people are recommending this, some people are recommending that. And what I would ask is, how effective is what you're being told? Does it work? How do you know?
All right.
Unless you test.
So briefly describe your system and how it's different.
Well, again, I approach your mouth as an ecology. I like to tell people that your teeth are like a coral reef, like an ocean reef, and your saliva is basically the ocean. If you have a coral reef and the ocean goes out or goes away and the coral reef dries up, what happens? You're in trouble.
Brittle, right.
And in the same way, if you pour toxins into the water around a coral reef, we all know today what happens to the ecology. Bad things change, things get mutated, wrong things grow, sometimes the whole thing gets killed off. And so people are now much more aware of ecologies in rainforests and our planet, and than maybe when I was talking about this 30 years ago. I used different analogies, but today I think the ecology analogy people can comprehend. also our digestive health. We know now, at least I assume most people that listen to your podcast are well aware of the diversity of bacteria in our digestive tracts, and that one of the things that happens when you're taking antibiotics or strong treatments and chemotherapy and hospital things often require the killing off of our natural digestive ecosystem. And we all know then that it's very hard. You have to really work to get back to health. There are things like probiotics and certain foods that feed those good bacteria, and that's how you reestablish health. I mean, I think we're on the same page, right? Yeah. And that your immune system being wrapped around your digestive tract is intimately connected with the health of your digestive tract. Well, take that whole knowledge base and put it in your mouth, because your mouth has 700 to 900 kinds of good bacteria found in healthy mouths.
Interesting.
And there are, so far as I know, about less than 20 known strains, and probably even less than that, bad guys. So we're talking about hundreds and hundreds of good ones and a very few bad ones. And dentistry has really for 100 years been fixated on killing, destroying, scraping, scratching, taking off. The word biofilm is often used in the dental office today. They're disrupting biofilm. They're giving you, toothpaste that has 24 hours to get rid of this biofilm, so that you want to drink certain drinks or rinse with certain things because it just gets rid of biofilm. And I would say that we have to rethink that completely, because your teeth are made of crystals, like a coral reef. They're very delicate, and they're covered by proteins. And then these proteins come from your saliva. They're in your own saliva. And we'll talk about that in a second, because saliva is key. And those proteins actually mesh with bacteria and form a covering over your teeth and your gums, your whole mouth. And that covering actually connects with the back of your nose, your sinus and sinus health, which means they're connected. Your ear health, your throat, your digestive health, your breathing health is intimately connected, all at the back here, by the biofilms that go from one area into another.
Now, are you referring to plaque as a biofilm, or is that totally different?
Well, if you are ever told about plaque, you want to ask somebody, what is plaque? What is it? I mean, people have this idea, it's like little bacteria with
bad bacteria that are...
Well, and that is true. But really what happens is healthy biofilm is this mesh of good bacteria woven into salivary proteins. That's simplistic, but think of it like that. And it's a fabric that covers everywhere and connects with other fabrics in other areas. Your entire inside of your body is lined with biofilm. It's supposed to be.
Correct.
When the wrong bacteria get into this biofilm, that is when bad things can start to happen. And there are always a few bad bacteria, just like our digestive tract. You don't want it to be, it's not good and bad. There are always a few bad guys. The question is balance. Mm-hmm. And in the mouth, when a certain kind of bacteria called strep mutans, that's the name of it, it's the most famous bacteria, it has a particular property in that it can use sugars from your diet, from carbohydrate breakdown. So anything that's a carbohydrate, which means a cracker, a cookie, in a drink, a sugar, any kind of sugar feeds this particular bacteria and energizes it. And when strep mutans is energized, it forms almost like little sticky pads that stick it to your teeth. And when it's stuck to a hard, non-shedding surface, in other words, your tooth, it will propagate. And if you look at these bacteria, they actually layer on teeth, and then they layer on each other with these sticky pads. And as they puff up, they can puff up and puff up and puff up. They're microscopic. I mean, they're like all bacteria. You can't really see them. But when they puff up the biofilm so thick, in 3 weeks, if you've ever scraped white stuff off your teeth, I hate to tell you, but that is what it is, a seething mass of those really bad bacteria that grow in sugary, carbohydrate, stagnant conditions stuck to a hard surface, and the only hard surface you have usually is your tooth. And the trouble is they create acids. And the acidity is another key component of bad oral health, because acidity is damaging to the good bacteria and helpful to these critters that cause all this damage. And strep mutans, when it gets so thick, the inside bacteria become anaerobic. And at that point, not only do these bacteria use sugars in your diet, but the anaerobic ones are able to ferment dairy. You know, like, yogurt and cheeses break down in anaerobic bacteria conditions. That is when the inside bacteria, these low oxygen bacteria, are able to actually use milk and milk products, and then cavities get formed by these really strong acids. I mean, this is when people have rampant tooth decay. And almost everything you eat is a problem then. There's very, very little that you can eat without generating. So the secret is to not have these particular bacteria. Instead of them, to have lots of healthy bacteria meshed in your healthy biofilm. And then everything looks after you instead of hurting you. So,
like a probiotic for the mouth.
Well, in a way that's impossible, because your mouth is not, you can take a probiotic for your digestive tract.
Correct.
It's designed to accommodate. Your mouth is supposed to be healthy. Nature designed it, but let's assume your mouth is healthy. It will protect you and repel invasion from the many kinds of bacteria. When you kiss somebody, or you interact with somebody, speaking close, sharing food, sipping on a cup that somebody else had, you have these other bacteria. You know, when somebody has a strep sore throat, similar kind of bacteria, they pass in saliva. Mm-hmm. Strep mutans is the bacteria we're talking about, same family of kind of bacteria. And so the mouth designed it that this healthy biofilm is resistant to picking up new bacteria. So if you have a healthy mouth, you can't take a probiotic, an oral probiotic, and expect it to do anything, because it will resist. One of the studies was very interesting. In the 60s, they took Navy recruits with great teeth, kids who obviously had healthy biofilm. They gave half of the group a dental cleaning. Then they made them all rinse with strep mutans, with this bad bacteria. Now I'm going to ask you, who do you think picked up the infection?
The ones who had the cleaning.
But if I tell that to traditional hygienists trained in a traditional, she cannot comprehend that, because they are trained that these cleanings are helpful.
Correct. That's how we've been trained, right? Every 6 months.
And the 6-month idea came from marketers, did not come from dentists. It was a tool by marketers to get you in every 6 months, which they thought was good for you, and dentists are trained to believe is good for you. I mean, this is the difficulty today. Everybody is trained in this philosophy because of the industry of dentistry. Now, I think you should go, but you should ask the question, do I need a cleaning? And if you don't need, emphasis is on the word need, a cleaning, then you should perhaps think about delaying it for another 6 months. See how long you can go. I think you should go regularly to be checked. You need an honest dentist so you can believe him or her, do I need a cleaning? And they're not just saying it.
So what are the parameters that would tell them that we need a cleaning?
Well, there you go. Now we can start talking about what is oral health. What is oral health? And you see, I go back to the story of challenging dentists. We actually did a test at a dental meeting. We did a test. You spit into a test tube your saliva, and they measure how many bad bacteria are floating in your saliva. And there were hundreds of dentists with a lot of bad bacteria floating in their saliva. A lot, most. And worse yet, they did a scan of the carotid arteries of those people, young dentists, 50% blockage, some of them. Some of them had carotid artery ages 20 plus years older than they were.
Amazing.
And I happen to be an outlier. I happen to have the almost perfect score in this test. And, you know, I can't yet prove, I'm going to, but I can't quite yet prove. But I can only tell you of my history of the way I take care of my teeth. I've shared with other people, and they've seen amazing results. And that it's based on the science of looking after the good bacteria, not harming it. And that when you don't floss, I had no plaque in my carotid arteries. They actually had to look at both sides because they couldn't believe at my age I would have nothing. And these young dentists who did floss had a lot of plaque. And one of the things that your blood system, you know, from your areas around your teeth go right down. Where it drains is right down past your carotid arteries. My question is, if you floss in an unhealthy mouth where you have these bad bacteria, are they actually being pushed into your bloodstream? That would be one concern. Not only do I not think flossing is adequate or effective enough, I think it's potentially dangerous. If you have an unhealthy mouth, if you're a heart attack waiting to happen, if you have a family history of stroke or, you know, high blood pressure or coronary heart disease, I don't think you should just go flossing in an unhealthy mouth. I think you should take this test and see if you have a seething mass of bad bacteria under your gums. Things you can't see, you don't know. And it's not cavity bacteria that we really worry about. It's a different kind that buries down under the gums, and they're painless, they're symptomless, they're extremely dangerous. And you really don't know if you've got a problem unless you do a test like the salivary test. And so I think people should take that test. What is the name of the test? There's a website called Oral, O-R-A-L, DNA.
Right, yeah, familiar with
oraldna.com. And it's a MyPeriopath test. That they do a lot of tests now. They used to only do one, but this MyPeriopath is these periodontal pathogens. In my new book, Mouth Care Comes Clean. Thank you so much.
Thank you for surprising me with this copy. It came in the mail yesterday. So
well, that book really talks quite a lot about this test because I am a big fan of this. Now, I think more testing will come out, but I like the concept of looking at the whole saliva, not just down one pocket, because you could have a stray spirochete and then get all upset and worked up. And, you know, one or two are maybe not a problem. It's all about what level. And when you do this oral DNA test, you get a picture of 11 pathogens in your mouth. How high are these levels?
I've done it, yes.
Compared with what is dangerous. I had a woman once, she was a woman in her early 60s. She was having braces put on her teeth. I met her at a cocktail party. She was talking about how you say you're a dentist, and I'm going to have these braces put on my teeth. And I said to her, really? Why are you, 60 years old, why are you having braces? And she said, oh, my teeth are moving around. Well, if your teeth are moving around, anyone over the age of 12, and your teeth are moving around, get this test done, because it's more likely that you have some sort of periodontal pathogens breaking the connection between your teeth and the bone, and your teeth will start to move because of this infection. And so I had her take this test, and she had I have never seen levels of the worst, the highest, most dangerous kind of bacteria ever And that bacteria actually appears to grow on toothbrushes, especially anaerobic. These are all anaerobic bacteria. They're bacteria that live in low oxygen. So if you travel, like this lady traveled all the time, and you have this infection and you put your toothbrush in a baggie, which is low oxygen, you will next time brush your teeth with worse bacteria and you will aggravate your problem. And if your toothbrush is anywhere near, in the bathroom, in the facility of bacteria that come from toilets and so forth, you're compounding everything. There are these simple things. You have to let your toothbrush dry for 24 hours a day. You have to. Which means you need a brush for the morning and a brush for the evening. Most people will do that. It's a $5 investment, right? I mean,
that's simple. That's simple.
And if you dry your toothbrush standing up so that, air can circulate around the bristles, that's really all you need to do to dry off these anaerobic bacteria and get rid of them so you don't have to worry. If you want a little bit of Listerine, helps, makes them looser, and then rinse it out and dry it, that's one step more. But just 2 toothbrushes will help you.
Interesting. Now,
and so I have very basic things. You ask me, what is my system? Well, my system starts with basic things. Things like 2 toothbrushes that are good toothbrushes.
Now, someone has a periopath oral DNA test done, and it comes back, and there's a lot of unhealthy bacteria. How did they resolve that?
Well, if they go to a normal dentist, they're going to be given an antibiotic.
Right. We don't want to do that.
And I take you then to a garden analogy, where in your garden, you can clean your garden with a blowtorch, right? And you will have a clean garden, no bad bacteria, everyone can celebrate. You have a clean garden. And that's what an antibiotic or chlorhexidine, these strong antiseptics can do. The trouble is, what's the first thing that's going to grow back in your garden?
Mm-hmm.
The strongest weeds, stronger ones, and they may have a chance now because they're not competing with anything else. So I go about this in a different way. I don't want to kill immediately everything. I would rather target a few of the worst bacteria and nurture as much as I can the ones that are going to be helpful. And it so happens the bacteria that are the most helpful to you, it would appear, and there's a lot of research necessary and needs to be done on the good bacteria in our mouths. And my mouth was tested. After we found out I didn't have bad ones, immediately I got a phone call from a dentist who wanted to see what was in my mouth. And he nearly fell down because he'd never seen such a wide diversity, low grade, wide diversity of everything, especially the ones found in healthy mouths. Now, I haven't had a cleaning in decades. So, it's allowed the good bacteria to, and some of my children have never had one cleaning in their lives. And that was when I forgot to tell them not to have a cleaning because they drove themselves to the dental appointment. And I'm not saying don't go to the dentist. Don't misunderstand me. I've had my teeth checked annually. I think we should go at least annually, even if you have nothing to do, to be looked at. And if you have health issues or, general health issues or mouth issues, you need more than that. Maybe every 3 months, but it doesn't mean you have to have a cleaning every time you go. That's what I'm saying. So I would have techniques to stimulate the growth of good bacteria. And the very best bacteria are called denitrifying bacteria. They're found particularly on the back of your tongue, in the middle of the back of your tongue, and also in your saliva, all around your mouth. But these are bacteria that take nitrates from your diet, and the nitrates actually come out in your saliva, in your mouth. We have to sort of talk about this now, where when you eat something, say you've just eaten some spinach, and I like people when they're trying to improve their mouth health to cook, lightly cook vegetables, even wilt their salads so it's easy to digest. Use a little butter with the vegetables so that it will dissolve the fat soluble minerals and make it easier for them to be absorbed. Butter forms butyrate, which is almost like moisturizer for your digestive tract. And and then there's food pairing, which I get into in my book, which foods you can eat with which. I don't know if you cover those topics, but it's all very interesting. And so you eat this healthy, wide, plant-based diet. And then if things are going well, you've got good, take a digestive probiotic if you need to, so that you will digest well. And then these nitrates from vegetables, and they are almost exclusively from green plant vegetables, will travel around in your blood, and the salivary glands that make the liquids come into your mouth are nestled in a nest. I mean, they really are bathed in blood. And that blood brings these nutrients, and they diffuse into your saliva liquids. And that's under here and in your cheek here. And these saliva glands they're so vascular. I mean, they're just embedded in these blood vessels so that this diffusion can take place. So nature's got it all organized. You don't have to do a thing except eat some good vegetables at every meal, and they will then get round to your saliva, come into your mouth. And if and you are bound to have a few of these good bacteria floating around, unless you've just done something catastrophic, then these good bacteria will start to have something to hold on to and grow and multiply. And what they do is they actually turn the nitrates into nitric oxide, which is good for your breathing, good for your circulation, and also protective of your gums and teeth. I mean, the whole thing works itself. You only have to eat well and give your mouth a chance. In that saliva liquid, there are immune cells from your immune system that will also help to take care of you. So give your mouth time. That's my second message, to interact with your saliva. If you are sipping water, as everybody is trained, I can't say the word. You say it, water. Say it for me. Water. Well,
Water.
Yes.
Water. Water sounds better.
No, it doesn't. I can't always get some. People tell me we don't have any, but it's that, you know. If you sip liquids of any kind constantly, you are thinning your saliva. You are interrupting this natural process that is designed to help you and heal your mouth and nurture the good bacteria and bring minerals to your teeth to heal them, strengthen them, whiten them naturally. You know, and so what we want is interaction with your saliva. Your saliva has a circadian rhythm. It has a flow and an ebb and a flow. There are times when it's best, there are times when it's not so good. In the afternoon, in the daylight hours when we're awake, is when it usually is at its best. So if you can just not eat or drink for an hour after lunch, or 2 hours would be great. And so that is sort of the core. Dry your toothbrush. Try to support your saliva with good nutrition and adequate hydration, but you don't have to sip, sip, sip. You can drink and then take a break, at least for an hour or two. And realize while you're doing that to lick your teeth. If you have dry teeth in the front because you talk all day, or because your lip is shorter, or because you have allergies, in that hour at least, try to, give your teeth time to interact with your saliva. Now, that takes me to my product. And I'm not here to sell my product, but I am here to tell you about xylitol. And I am Ellie.
Ellie's gum and all kinds of delicious mints. Yes, thank you. And I do want to tell our audience too, you've been so generous in donating products for our Healing Diva retreat. So thank you so much.
I've donated a lot over the years because I care. And I care that people have no idea about xylitol. And what it does, and you're going to understand it now from what we just talked about, it generates a flow of saliva into your mouth. Xylitol is hygroscopic. It means it pulls water to itself. If you put it in a room, a steam room that's hot, it will just melt because it will pull the water and just disintegrate. In Chicago in the winter, if it's humid and cold, and xylitol will grow what looks like almost like a fuzz on the outside of it because it pulls this water from the air. And in your mouth, when you put in that mint, the only place that water can come is the roof of your mouth. It's going to pull saliva from the roof of your mouth. And that saliva is almost always alkaline. And that liquid you feel in your mouth now is densely mineralized, and it is flowing all over your coral reef of teeth. Mm-hmm. It is providing the minerals because it's alkaline. The good bacteria in your mouth are having a happy day. They are not bathed in acidity from stress and from dry mouth and from medications that dry your mouth. They are now happy because they have a liquid, they have a good liquid, they have a liquid that's got the right mineral. Your own saliva has come in. It's not the xylitol. The xylitol simply drew this into your mouth to take care of you. You are taking care of you. Now, xylitol happens to also feed all the bacteria in your mouth, good and bad. It's the garden fertilizer for everything, if we take our garden analogy. So we are feeding the weeds, we are feeding the good grass and flowers, we're not killing anything, we're feeding it all. The difference is that, you remember the sticky bacteria we talked about at the beginning, strep mutans? It loves xylitol because it thinks it's sugar. I mean, it doesn't have a thought.
Right.
So it absorbs it quickly. It's a smaller molecule, actually, and it absorbs it. And the trouble is it cannot process xylitol. It's the wrong shape molecule. A sugar molecule is 6 carbon. In fact, all the sorbitol, mannitol, maltitol, all those, I don't like any of those things. Those are all sugar alcohols. They are all 6 carbon molecules as well. And plaque can use them eventually. It takes them a while to learn how to use them. But if you eat a lot of sugarless gum with sorbitol, you will have plaque will learn how to use it, and you can get plaque growth. So sugarless isn't always safe for teeth, is a message too. But these strep mutans try to get rid of the xylitol because they don't want that. They're not able to feed on it and multiply. Because they can't feed on it, they don't make acids. Because they can't feed on it, they have no energy to reproduce. They have no energy to form sticky pads. And because they keep trying to get rid of the xylitol, they actually lose energy and become deficient. So they easily get washed off your teeth. So if you want to get rid of plaque, these so-called plaque, infected strep mutans mushing together on your teeth, just have a little xylitol. And the tiniest amount. You just ate 1 mint, I think. Was it 1 or 2?
2.
Okay. 1 mint is half a gram. 2 mints is 1 gram. A teaspoon of xylitol would be 5 grams, 10 mints. You don't need more than a teaspoon of xylitol a day to do unbelievable things to your mouth. You can take 2 teaspoons, which would be 20 mints. For osteoporosis in Europe, they eat the equivalent of 40 mints a day.
Wow.
I mean, don't be scared of xylitol, but on the other hand, you don't need that much. And I'm not recommending that much. I'm recommending like the teaspoon, which would be 5 grams, 5 pieces of gum, 10 mints. But the more you can space them out through the day, the more effective you will it will be. So you really want to use them throughout the day rather than just put them in your tea and then drink them, because you won't get this hygroscopic effect. And when you need this help most is after meals. Every time you eat or drink, your mouth will usually be acidic for an hour. I'm sure many of your listeners have been told, don't brush your teeth straight after a meal because you'll wear your enamel away. That's because enamel wears away when your mouth's acidic. And after a meal, your mouth's acidic for about an hour. So instead of waiting an hour, because if you eat 3 times, I eat 5 times a day probably, that'd be 5 hours of damage. take one of these mints, and immediately the acidity is gone. So you've saved 5 hours of damage. You've stimulated healthy saliva. You've fed the good bacteria. You've got rid of it. Why wouldn't everybody do this?
It's a very good question. Very good question. So we have time for one more question. There's different kinds of dentistry available. There's the biomimetic, there's the biological, there's the oral systemic, biological dentistry. All of these are very popular now. So can you briefly explain which method? Well, you probably don't adhere to any of them, or what?
Well, the best dentistry is no dentistry.
Okay.
And if your dentist is honest and will tell you that, I would go to him whatever he puts a category. Because you've got to realize today, dentists are always looking for work, and they know that a lot of people are scared. And if they go no fluoride, if they go biologic, if they put up the right decorations, people will be drawn in. It's a selling technique. Mm-hmm. So let's be honest. There are lots of biologic dentists doing a lot of dentistry for people. They are anti-fluoride, and that's how they get you in. And then the next thing, you've got broken teeth. You're having a root canal, you're having a crown, they're suggesting all your amalgams get replaced. What are they replacing them with, would be my question. I have silver amalgams in my mouth. I'm well aware of the toxicity of mercury. I was furious about it. It was in the hatting industry. You know that the Mad Hatter in Alice in Wonderland? Mm-hmm. It was mercury poison. I am very aware. I used to mix it up in my hand in the 60s. I used to put the silver amalgam right there in the palm of my hand and then press into it as I was filling my packing and stuff to put. We worked with mercury, and no masks, no eyewear, nothing, no gloves. But the most dangerous time is the putting in and the taking out. And I have them in my mouth already, and I am scared of the taking out. I am also scared of white filling materials because it's BPA. It's estrogen mimicking stuff. I mean, unless you are totally understanding of that and have prepared yourself for an influx of this chemical, plastic white fillings have plenty of downside. And they have been put in people's mouths as if they were the panacea for silver amalgam. I think no filling is really healthy. What I plan to do is cover my silver amalgams with gold. I honestly believe, my heart believes that gold is the only safe filling material. And I will probably cover the few fillings I have at the back. I mean, in the front, you've probably got to use ceramic. But people need to be aware that most dental products are not safe. So you want to try and avoid them. And that means, can you not have this work done right now? And can you wait until you are totally healthy? I think so many people, particularly people who have experienced cancer or are worried, do these treatments, have the fillings taken out and replaced thinking it's positive. I think you've got to try to balance that. I think there's danger in taking them out, even by a so-called biologic dentist. I just think you need an honest dentist. I think you need to test your mouth health. Think you need to get your mouth health as healthy as you can before you make any change. And do as little dentistry, actual dentistry, as you can possibly have that keeps your teeth safe and keeps you safe. And really, my book has a lot more on that whole topic. I'm not against traditional dentists. I think it's honesty and their judgment and you being empowered. You really have to empower yourself. I'm sure you have the same message about doctors.
Absolutely, yeah.
And you ask your friends, who do you trust? Who's been good to your family? Who's been good to you? Who tells you you don't need this? And I'm hoping that more and more dentists will understand, particularly children. Take a child and say, does my child need a cleaning? And see what happens. And they may say to you, but your insurance will pay for it. And I'm a pediatric dentist. I've asked this question, why do we clean the teeth of children who don't need cleanings? And the current answer is it takes too long to explain to the parents.
Are you kidding? Wow.
I'm not kidding. So parents need to have this explained to them. And if you ask your dentist, do you need a cleaning, and they look confused, ask them again and see. And if not, maybe we need to send them one of my books.
Okay.
No, I don't want to upset people, but I also feel that the public has been brainwashed into believing that we have no power. And I'm about empowerment. And that feels good.
Yeah, totally on the same page with you there. I don't know that if I totally agree with you as far as the amalgams. I'm not a dentist.
Definitely toxic. I mean, I'm not saying they're not toxic, but I just think you have to balance what are you putting in their place.
Exactly.
Can you cover them with gold instead of taking them completely out? Because so often when they're taken out, unless they're taken out well,
correct,
the next thing you have is this pain because of poor adhesion. And then the next thing is you have an irritated nerve. You'll have a root canal. Then you've got another problem to contend with.
Correct.
That's a whole other topic, root canals. We can come back another day and we can talk about those. But none of this stuff gets better as it gets bigger. And really, the Academy of Biomimetic dentists do fabulous adhesive dentistry, white filling dentistry. They are trained in techniques that are spectacular. There are, I think in America, only about 100 or 200 of them. Biomimetic. It's the Academy of Biomimetic Dentistry. Wonderful. And the president was Saul Pressner in New York, and if you contact him, he could tell you in your area where somebody might be, but they really do beautiful, they respect teeth highly, and they want to do one filling that will last you for life. And
that's great.
That is why I got invited to speak to them, because they understand that keeping your mouth healthy is so important.
So important. Well, thank you so much for your time and your
nice to meet you finally.
Yes, and your information. Greatly appreciate it. And make sure you pick up Dr. Ellie Phillips' book. It's Mouth Care Comes Clean. So I'm looking forward to diving into that and learning a lot more. So thank you so much for your time.
Pleasure. Thank you for inviting me. Take care.